shall also be amplifying some of the things the Secretary to the Government has already said, and also provide details. Over the weekend, we recorded 42 new cases, bringing to a total of 232 the number of confirmed cases of COVID-19 in Nigeria. They are in 14 states and the Federal Capital Territory as at today, the 6th of April, 2020. We have recorded 5 fatalities in total, all with underlying ailments. A total of 33 patients have been discharged from treatment, and we have 120 patients in Lagos State, 47 in the FCT, Osun 20, Oyo 9, Edo 9, Bauchi 6, Akwa Ibom 5, Kaduna 5, Ogun 4, Enugu 4, Ekiti 2, while Ondo, Rivers, and Benue have 1 each. Through enhanced surveillance systems and strengthened epidemic intelligence, we continue to detect cases of COVID-19 and treat them to recovery. We have tested over 5,000 samples so far and are working hard to scale up capacity in a targeted approach. The increase in cases with no clear epidemiological definition will mean that there will be a need to discuss changes in our public advisory. This will be after the Ministry of Health and its agencies have sat down to review and analyze the situation. Since the last briefing, we have activated 2 additional laboratories for COVID-19 testing at the Defense Reference Laboratory, which is here in Abuja, and at the Biosafety Laboratory in Lagos. In the coming month, we intend to expand to more laboratories with capacity to treat COVID-19. We have also identified additional treatment centers in Utako and Mabushi, which will give us a minimum of 400 beds, and they are presently under renovation and repair. We inspected these sites over the weekend. The Hospital Accreditation Committee, which is led by the Honorable Commissioner of Lagos State and the team from IRWA and includes NCDC and directors of Ministry of Health, has inspected and accredited 3 centers in Abuja, and will continue with that as time goes on. We are working with the African Union to develop a continental response, and a joint continental strategy for COVID-19 response has been developed with the African Task Force on Coronavirus to set up and coordinate preparedness and response in a coordinated fashion on the continent. On Friday, I announced that an 18-man team of Chinese medical technical experts is expected in Nigeria with the consignment of globally scarce supplies to augment government efforts and build capacity to contain the outbreak. The equipment include PPEs and consumables and more than 1 million masks for workers and even ICU ventilators. Many of you read the news, we know that there is global competition for masks and that certain countries have been accusing each other of capturing each other's masks, as there has also been a global competition for ventilators with some countries donating ventilators to others and also swapping ventilators. So therefore, it is particularly gratifying that in the face of all of this, we are able to get these supplies here, which even if you had the money, you may not have been able to order. In addition, the technical experts, they comprise research doctors, nurses, and laboratory technicians with public health managers who will share their own knowledge and skills and their real-life experience of fighting COVID-19 with Nigerian experts, Nigerian personnel, to strengthen our own management of cases, especially with regard to critical care. As we all know, this country has had quite an experience with it. Now, this initiative will greatly build the capacity of our hardworking and resourceful Nigerian healthcare workers who are at the forefront of fighting the virus. But the most needed personal protective equipment and masks will also protect our frontline workers and mitigate the spread of this disease. We do have a window of opportunity to strengthen strengthen our response mechanism through lessons we learn from any country at all that has had the experience and can provide hands-on demonstration of how to deal with the outbreak and give the Nigerian clinical workforce the opportunity of sharing global best practices. While ensuring that we do not lose gains made in the health sector, we shall continue to support the states in strengthening their preparedness and their response to COVID-19. Rapid response teams have been deployed to many affected states to support their response. Yes, once again, I want to advise that older persons and persons with vulnerable underlying ailments be protected, put in protected isolation, especially from persons who may fit the case definition of coronavirus infected persons or who have been abroad or have been close contacts of those who have been abroad. Because as you know, there are persons who may be carriers and are not necessarily demonstrating any symptoms. Thank you.